As of this week, we are going to open up the use of the Pfizer to anyone who would like to get the Pfizer vaccine. So basically now anybody 12 years and above can access the Pfizer vaccine.
The local health minister during his COVID-19 update on Thursday. In August, the first tranche of 146,250 doses of the Pfizer vaccines were received by the government of Guyana through a donation from the United States. At that time, the minister had announced that the shots would only be used to inoculate the country's adolescent population, 12 to 17 years old. However, in October, an additional 100,620 doses of the Pfizer vaccine were received by government through COVAX, resulting in the vaccines being extended to expectant and breastfeeding women. Against this backdrop, the minister on Monday conveyed that a few persons have been asking when the vaccine would be available to the general public. He is hopeful that making the Pfizer jabs more widely accessible will motivate the still hesitant cohort of the population to take the jab. It was also related the ministry has commenced training its staff to administer the Pfizer vaccine to children from ages 5 to 11.
This particular age group would require a vaccine that is 1/3 of the current dose that we are giving. And we have started that training. We are expecting that during this week we'll complete that training.
The Pfizer vaccine was recently approved by the U.S. Food and Drug Administration for emergency use in children who fall in the 5 to 11 age category. However, the vaccine must also gain the approval of the U.S. Centers for Disease Control and Prevention, CDC. Once this approval is given, the local government analyst Food and Drug Department will approve the vaccine's usage in Guyana. So far, 27,401 adolescents, or 37.6% of the adolescent population, has received a first dose of the Pfizer vaccine, while 18,271 adolescents, or 25.1% of the adolescent population, have received both shots. Additionally, 382,177 adults, or 74.5% of the adult population, have received the first dose of a COVID-19 vaccine, while 244,322 adults, or 47.6% of the adult population, have received both doses. Meanwhile, as it relates to the recently updated gazetted COVID-19 order, which stipulates that only fully vaccinated persons will be allowed entry into both private and public buildings, the minister said that persons had a long time to get themselves in order.
And that is why this measure is necessary, so that people get both doses of the 2-dose vaccine. And after your second dose, 14 days after, you're considered to be fully vaccinated. So it's important, at least, that those who have not yet get their second dose, that they go to one of the vaccination sites and get those second doses.
The new measure stipulates that unvaccinated persons, or those who are only partially vaccinated, will be required to present a negative PCR COVID-19 test result. Additionally, it is not expected that the extension of the national curfew will contribute to the rise in COVID-19 new infection, hospitalization, and deaths locally.
The increase in cases will depend on people's attitude. And I think we've had more than a year and a half where people get to understand the disease and the precautions that they need to take.
The national curfew, which has been from 10:30 p.m. to 4 a.m. for a number of months, was recently extended to 12 a.m. to 4 a.m., which allows businesses to operate until 11 p.m. as opposed to the previous 9:30 p.m. deadline. For the HGP 90 News, Kendell Richmond.